be with us today. On behalf of Department of Defense and Strategic Studies, we invite all the participants here. Our colleagues is there. Former Principal Dr. Jacob John is with us. Many eminent doctors is with us today. Even some of the journalists are on today for this webinar. So on my behalf, on behalf of Buddhist College, I invite all the participants to this webinar. Now without much taking time, I hand over the session to Dr. JJ. This whole 45 minutes going to be 20 minutes talk by Dr. JJ, followed by few questions. He said he accept few questions. That's for this webinar. Doctor, I hand over the session to Dr. JJ. My special welcome to all the Rotarian friends who join in this webinar group. Thank you, Doctor. Go ahead.
Thank you very much, Rotarian Tirumaran. It's a pleasure to address the faculty of Buddhist College and my Rotarian friends. This is a wonderful new trick that an old dog has learned. See how a virus could teach people many new things. I have lived through several pandemics. Pandemic is when an infectious disease goes to many countries. A few pandemics have gone around to all the countries in the world. 1957 and 1968 influenza pandemics went around the world. All countries were affected. 1970, I don't know, many people may remember Apollo I, the red bleeding conjunctivitis that stayed essentially in Asian tropical countries. No loss of life. The last time I addressed Muri's faculty and students was in 1986, when the HIV pandemic had reached India. Another one that went around the globe to almost all the countries of the world. 2002, chikungunya was a pandemic, and that came to India. And if anyone had a chikungunya attack, you will never forget the pain that it caused. Very few loss of life. 2009 swine flu, or H1N1, came to teach us what the 2020 pandemic would be like. H1N1 had a mortality of something like 0.1%, 1 per 1,000. Particularly old people, pregnant women, small children below 3. These were the groups that were badly affected in the 2009 pandemic flu. This 2020 pandemic of coronavirus, causing the disease called coronavirus disease 2019, is 10 to 30 times killer than the 2009 pandemic. That is why the whole world is concerned, because pandemic flu itself was bad news, and this is 30 times worse news for people. the way the coronavirus spreads is very much like influenza, and it is through droplets. I would like you to do a small experiment sometime. Take a piece of glass, bring it now down very close to your nose, and breathe out. You will see two circles of moisture on the glass. Usually one side bigger than the other side, and it will alternate after a while if you repeat it. The point I'm saying is tiny droplets of respiratory fluids come out when we breathe out. When you speak, you throw more bigger droplets out. You can do an experiment by holding a mirror in front of your mouth about 6 to 9 inches away, and then you speak, you will see a spray of droplets falling on the mirror. If you cough, the number of droplets would be many thousand times more, and if you sneeze, the droplets that come through the nose would be in the millions. And if a person is infected with coronavirus, these are the ways the coronavirus comes out of the body of the infected person. And if anyone is nearby, within 3 feet particularly, then you tend to inhale some droplets. If somebody coughs or sneezes, you could be 10 feet away. You may still inhale some of the small droplets that came out. So we are social animals and we meet each other very often, shake hands, pat on the back, and our faces come within 2 feet of each other, and we don't worry about droplets. But now, as long as the coronavirus is in epidemic form, we've got to be very careful about the droplets, which is the vehicle through which we get infected. So, ordinary social contact that is necessary for our mental health, socio-cultural events, celebrations, get-togethers, that is the time when the virus spreads very fast. Therefore, physical distancing is one way that you can slow the epidemic down. Wearing masks, if 100% people wear masks, the epidemic will slow down dramatically, drastically. Now, why do not countries go enforcing mask wearing, instead go for lockdown? Is because every hammer loves a nail. The hammer would protest if it is used as a paperweight. So governments usually use heavy-handed, administration-heavy, dramatic, sensational interventions rather than very simple intervention called mask wearing. Okay, the topic Maran and I decided was, when will the pandemic peak and the curve turn down? Now, every new infectious disease that becomes an epidemic,
It's not
you
audio.
have to imagine a curve going up,
Losing me.
reaching a peak, and then coming down. If you imagine this curve as a normal distribution
में ऑडियो
or
ऑप्शन ये है ना,
bell-shaped curve,
ये है
तो
ना,
सही है.
Doctor, sorry, doctor. Doctor, unmute your video, doctor. Unmute your audio. Unmute your audio. I mute everyone. You again unmute your audio, doctor.
yes,
Yes, doctor. Fine.
I'm
Go
unmuted.
ahead. Go ahead, doctor.
Okay.
Yeah.
Did you hear up to here, the curve? The bell-shaped curve, which is a normal distribution. Epidemics don't quite follow that bell-shaped curve always. However, the bell-shaped curve is a mirror image of the left side on the right side, which means when at the end of the epidemic, when you look back, you will know that half the people who participated in the epidemic got infected before the peak, and half of the people who got infected after the peak. So when the peak comes, don't think that everything is over, that everybody is out of the woods, life is back to normal. No. Until the curve comes to touch the bottom line or near the bottom line, until then the epidemic is on. So the peak is midway of the epidemic. Now, as many of you would have read my paper a couple of days ago in New Indian Express, we expect the peak to occur somewhere between July and 2 weeks of August. Within that 6 weeks time, we hope the peak will come, which means by the time half the people who are destined to get infected would have got infected, and the other half will get infected during the next September, October, November, December, and maybe going on to early part of 2021. So the epidemic is on until the numbers come down to very low, at which time the virus will be spreading extremely infrequently, but it will continue to spread. That is the phase that we call endemic. Influenza is endemic now with seasonal ups and downs, low season, high season. Most of the year in India is low season. Around the monsoon time is the high season. We think that the coronavirus also will become endemic like that, and from 2021 onwards, we will have low season during most of the year,
100 வந்துட்டாங்க மேம் 100 வந்துட்டாங்க
high season during perhaps
அதான் மேம்
the cool months
already 100
or during the monsoon months. So that is about the
அவங்க லிங்க்
pandemic peak
லிங்க்
and the curve turning down and becoming endemic.
YouTube link பண்றேன்.
India has 3 advantages as we face this pandemic or the epidemic in India. First was we got importation of the virus quite late. compared to
What do you
Western
think?
countries or the Middle East,
என்னன்னு தெரியலையே.
which means that our
Settings
peak is
மாத்திட்டு
going to be
நீங்க உங்க
later
audio
than the
இல்லையா?
peak in all the other countries.
மைக்ரோஃபோன் வந்து மியூட் பண்ணிட்டீங்களா? அதை ஆன் பண்ணுங்க. ஆன் பண்ணி பாருங்க.
Many people think about Italy as badly affected.
அந்த இது லாஸ்ட்ல இருக்க பாருங்க, எண்ட்ல இருக்க பாருங்க.
You know that Italy's peak is over.
போன்ல தான் நிக்கீங்க.
Italy got infected most probably in December onwards.
நான் உங்களுக்கு
So December, January, February, March,
ஆன் பண்ணி பாருங்க.
it peaked, and since
அப்படியா? நான்
April,
லிங்க் அனுப்புறேன்.
the curve is coming down. The epidemic is still not over.
செக் பண்றோம்.
So we got infected essentially towards the end of March in a reasonably big way. And so April, May, June, July, that's the time when we can expect the peak. So that is our first advantage, that we had much more lead time, warning. But unfortunately, India did not take that warning seriously. And for some reason that I don't understand, there was a certain optimism and confidence that India will not be badly affected by a lot of people, including the government, which was a error in judgment. The second advantage for India is that this particular epidemic has a high mortality. I said 10 to 30 times higher than H1N1 2009 pandemic influenza. But there is an important hidden element. The mortality rate is proportional to your age increment from about 60 upwards. The higher higher the age group, the higher the mortality. The older the age group, higher the mortality. Younger the age group, lower the mortality. Our life expectancy, longevity is about 70 years. Compare that to Italy's longevity of 83 years, 82 years. So that means our population is relatively young. 50% of our population are below 50 years. Only 5% of India's population is above 65, and they will bear the brunt of mortality of this epidemic. So until the epidemic is over, everybody above 65 or those with chronic non-communicable diseases like diabetes, hypertension, chronic lung disease, heart disease, kidney disease, liver disease, should, as far as possible, stay home in quarantine. Now, classically, the infected people are in quarantine, uninfected people are free to continue their social, economic activities. So here, the seniors and the people with the risk factors should remain in reverse quarantine or remain cocooned within their families with very careful infection prevention routine at home. Now, if their grandparents and grandchildren come home, you should definitely interact between the grandparents and grandchildren. However, there's a difference. Grandparents and grandchildren should wear masks, and they should remain reasonably distanced, like 4 feet to 6 feet, and then you can talk, you can sing, you can do whatever you like in the family situation. When grandparents come to eat, there should be no one else within 3 to 4 feet, and they should wear mask all the time. Of course, grandparents, when they eat, cannot wear masks. The same true for others. When you eat, you cannot wear masks, but everyone else, those who serve, those who sit and talk, they should all be wearing masks. So the second advantage is our age structure. Only 5% of our population, which is 10% is 134 million, 5% is about 65 million. Interestingly, that's about the population of Italy. So what Italy went through, our senior citizens will go through. If Italy had 35,000 deaths, we can expect at least 35,000 deaths among the senior citizens. So therefore, cocooning is very important until the epidemic dies down or a vaccine becomes available, hopefully in early 2021. Now, in the younger population, especially those who have obesity and other comorbidity conditions, there will be an unacceptable level of mortality, as we already have seen in medical people and in many other situations. So our second advantage, I said, is the age structure. The third advantage that India has, if at all it is an advantage, and people think it is an advantage, is that we have universal BCG, which somehow trains the immune system to attack early infections that go inside your cells. Viruses go inside your cells. So we may have some slight advantage on the whole in the community, not for individuals, but as a group. We might have some advantage due to BCG. The second such element is large numbers of dengue. Some people call it dengue. So we have massive epidemics of dengue recurrent in many years, and that also seems to train your immune system to be ready to attack infections that go inside the cell. That immunity should not be mistaken for antiviral immunity. The first immunity is called innate. That is inherent. That is something everybody has. But antiviral immunity is specific to that one virus, whether it is chikungunya or influenza or measles, polio, or the coronavirus. It is specific. That immunity cannot be stimulated by anything that you take in, any herbal medicine, any health food, vitamins. None of these can make the body respond to the virus in a specific manner. Only vaccine can simulate the infection and induce virus-specific antibody. So until vaccine comes, everyone has to be on their toes, and senior citizens and those with what we call comorbidities, the vulnerable people should be extremely careful when they move out of the house. As far as antiviral treatment is concerned, we don't have anything yet. We do have something which, like the mask wearing, I do not understand why experts are not applying wisdom. Convalescent COVID patients or those who are infected with COVID make their own specific antibody, and that is antiviral. That is why I have been promoting convalescent plasma therapy for severely ill COVID people. As I said, very few proportion of people will go into severe disease, and for them, mortality is very high, up to 10–20%, and the ready treatment available is convalescent plasma therapy. And like the mask, it is too simple. Therefore, it did not become popular until about 2 weeks ago. Now it is becoming popular. So we could have prevented a number of deaths, especially the doctor, 55-year-old neurosurgeon, wasn't he, who died in Chennai. Plasma therapy is available antiviral treatment. One antiviral drug, remdesivir, is under evaluation. It looks like that may be antiviral, and other antivirals may appear in due course. However, the prospects of a vaccine is very high. Several candidate vaccines are under investigation, and one of the front runners is the Oxford University vaccine. One Indian company in Pune, Serum Institute of India, has already made preparations to upscale the production of that vaccine if that vaccine trial in the UK becomes successful. And this company is getting ready to manufacture 1 million doses within a short time, and to sell the vaccine at 1,000 rupees per dose. You will normally require 2 doses. So there is some hope that the vaccine, either the Oxford vaccine, there are many other vaccines being tried in the US, South Korea, China, Italy. There are many places where vaccines are being designed and tried, and even India has just started contracting to one company in Hyderabad, and the ICMR developing the technology to be transferred to this vaccine manufacturer in Hyderabad. And hopefully, if it becomes successful, then we will have our own vaccine. Okay, so that will cover all the things that I wanted to tell you, the bad news and the good news. And we will have to learn, as long as this virus remains in our communities, as long as we have the fear of severe disease in senior citizens and those with chronic non-communicable diseases, we'll all be on our toes. Our public meetings will have to be carefully managed with physical distancing and mask wearing. Everyone should be using hand hygiene, hand sanitization, hand washing, because touch is an important way the virus can be transmitted from various surfaces. Self-inoculating into your own eyes or nostril, etc. So mask wearing and careful hand hygiene practices will take the sting away from the epidemic. I have been hoping, promoting and requesting both state governments and central government to make mask wearing compulsory and universal. Hopefully my voice may be heard. I've been promoting this for quite some time now, and the rest of the world is now coming around with mask using as a simple intervention to flatten the curve. Flatten the curve means delay the peak and let the peak be much dwarfed than the peak if it's not flattened. But remember, the area under the curve, unflattened or flattened, will be identical. The same number of people will have to get infected before the epidemic becomes endemic. And what is that number? 700 to 800 million people will have to get infected. How many have been infected? How many do we know have been infected? The count is 70,000. 70,000 actually means at least 7 lakhs infected or 1 million infected. So we haven't even reached 1% of our total population. And imagine when we will reach 50 to 60% of the epidemic. Don't be alarmed. 80–85% of these infections will be unknown to everybody, asymptomatic. I suspect even now, perhaps 2 to 3 million people have already been infected, out of whom we have only found 70,000 by testing. Testing has a place, but clinical diagnosis has a place. The more clinical diagnosis we do, the more numbers will turn up. That is a medical subject, so I will not bother you with that. Let me thank you all for a patient listening, and if you have questions, do please inform the moderator. I will try to answer the best of my ability. Thank you all very much. Maran?
It's one side, it's very alarming. You said that we touched not even 1% of our population. You said definitely 60% of the population going to be affected. Is it, doctor?
Yes. Yes.
It is so, doctor.
Yes.
Likely.
So let me tell you, yeah, you know the story of the person who asked for a chessboard and said, put 1 grain in the first box and you double in the next box and you double in the next box. You know that story. By the time the end of the chess box came, the entire grain granary of the king was depleted. So as time goes on, the doubling is going to be massive. The day we have 1 million, the next doubling is 2 million. Next doubling is 4 million. Next doubling is 8 million. In the same time as it took for the first doubling of 100 to 200, 1,000 to 2,000, same time frame. So don't be alarmed, it's coming, and that is how we have predicted July to August as the peak. and thereafter the epidemic will be coming down. Is that clear, Maran?
Yes, doctor. So August we can expect the peak in India.
The peak, we can't expect a peak by, we don't predict it by the day or the week. So we have a broad framework of any time in July to mid-August. Okay. So during that few weeks, we will reach the peak and then the curve will turn down. Mind you, our data coming out of the government is cumulative data. The cumulative data will not show the peak. A true epidemic curve is the number of cases day by day or week by week. We are not calculating that numbers because the government wants to know the day by day increments. So it can only go keeping up. It will creep up until it reaches
Yes, doctor.
70–80% of our population. So you will not see the peak in that curve. For the
Yes, doctor.
peak, we have to have a different curve.
One question has come, doctor. Should the lockdown be extended till August? Should the lockdown be extended till August? As you said, peak will occur by August.
Lockdown is like if you have a house in which there are a couple of rats, you can close the house and burn it. The rats will definitely die. But your house also will burn down. Lockdown is a cruel, drastic, dramatic intervention with the economy and social life and mental health all being affected. It had a place in the very early phase, that is from 25th of March to 14th of April. It had a very, very definite place because everybody had to absorb the bad news, understand the problem, stay inside the houses, slow down the epidemic, and the lockdown should have been lifted on April 15th. Thereafter, 100% homemade mask wearing should have been the best way for India to move forward. So I am in total disagreement with the government's idea of extending the lockdown beyond April 15, second phase, third phase. I hope there will be no more phases of lockdown. Lockdown is, the disease is worse than the treatment kind of story. Okay? So I don't believe that any sensible administrator will extend the lockdown anymore. This is the time to slowly lift the lockdown with one particular stipulation: 100% mask wearing. Children from 10 years to 7 years upwards, everyone should wear masks when they're outside their homes. The Chief Minister, the District Collector, the Medical Officer, Rotarians, teachers, everyone should wear masks, and everyone should encourage people to wear masks. In that case, there is no more need for lockdown.
Thank you, doctor.
Can I ask one question?
Krishnan sir, yes sir.
Kumaran allowing me to talk?
Yes sir, Krishnan sir, you can ask now.
Okay, doctor.
Agri, I'll call you back. Sorry.
Dr. Krishnan.
Yes.
Yeah. Your calculation of the curves is based on statistical theory. Am I right?
Tell me again, D.
Your calculation of curve peaking up and slowing down are based on statistical theory. statistical mode, or what is the, how do you calculate the curve?
Yes.
Because
Um,
most of them, we don't know about anything, mostly about, we have not yet found out what is about coronavirus, how it is made up and how we are going to defeat it. Then how do you make the curve?
Okay.
Hmm.
People keep on saying we don't know very much about the coronavirus, but we know almost everything about the coronavirus.
I agree.
There is nothing that we do not know that is of importance in terms of the coronavirus.
Okay.
What we do not know is we don't have an antiviral drug because it's a very recent epidemic. So people have not had even 2 years of time to make an antiviral. But I'm
Okay.
sure we will probably come with an antiviral within 1 year. We don't have a vaccine. What we do not know is what happens inside the body of a severely affected COVID patient.
Okay.
We are now getting a lot of information saying that people always thought it was pneumonia. Pneumonia is not the important issue. It causes a lot of blood clots, tiny, tiny, tiny blood clots in your capillaries. And that's why kidneys fail. That is why we have stroke. That's why hearts fail. A lot of people recover from the severe corona disease, come out and then die of heart attack or cardiac arrest. So we are.
Doctor, unmute yourself, doctor. Doctor, unmute yourself. Yes, doctor.
The more we know about the virus, the more surprised we are that a simple mask wearing is sufficient to protect against this virus. That comes out of knowing more about the virus. So we know a lot about the virus. So the calculation of a peak is based on what is called epidemiology intelligence. The criminal intelligence people will have a good idea as to what criminals will do. Call me back after half an hour. So that is criminal intelligence. Army has their intelligence about the enemy. All countries have their intelligence again about other countries. When it comes to infectious diseases, we have something called infectious epidemiology intelligence. That's what I am best known in the world for, epidemiology intelligence. I've sorted out a lot of diseases which others could not detect or diagnose by using epidemiology intelligence. So I'm using that skill to predict what is likely to happen with this particular epidemic. I may be wrong, but the chances of my being wrong is very small.
Dr. Ramkumar here. Hello.
Yes.
Doctor, see, the best way we are talking about to protect is to increase our immune system. So can you please guide us to how to increase our immune system to defeat this disease or to protect ourselves, doctor? So what are the intakes? So some people are taking vitamin D tablets regularly. So what are the, is that right? Or what are the other ways to increase our immune system, doctor?
Okay, that's a good question. Our immune system ages, and as you grow older than 55, 60, 65, our immune system is tired and not as agile, not as quick to react, and not as strong in their reaction. That's the reason why mortality is high above the age of 65, particularly when it comes to 80, 85. Your immune system is, you called senility or senescence as certain, old age of the immune system. Now, young people should have strong immune systems. If you have diabetes, chronic diseases, you're on drugs that affect your immune system, anti-cancer drugs, and so on and so forth, your immune system is affected. All other normal people, if they are well nourished, fairly well upon their vitamins, you cannot make their immune system any stronger than that. as I mentioned, trained by BCG and dengue, we may have slightly more alert innate immune system. So all immune system strengthenings are of very little value when you face the enemy, the COVID virus infection. As I also mentioned, immunity is what the body responds with after the virus enters the body. Antiviral immunity is highly specific. It's like going to a tailor and getting your suit stitched to fit you. The antiviral immunity fits that particular virus. You cannot think that your immune system being strong will fight any virus. No, it will only fight after the virus enters the body. The hype about vitamin D, zinc, etc. are not applicable in individual cases. We all should be well up on our vitamins D and our minerals, including zinc, because these are protective against severe diseases with every infection, bacterial and viral. But by strengthening that, you cannot prevent the virus infecting yourself or any other infectious disease agent infecting yourself. So
Yes,
immune
Doctor.
system strengthening has a very, very minor role, but not a specific or predictable role.
Doctor,
Would
do you
you
suggest-
please give any
Yes.
specific advice to the diabetic people, doctor?
Yes, as
Hello?
long as diabetic people have, can you hear me?
yes, doctor.
Am I
Yes,
audible?
Yeah, doctor, please go ahead.
Yeah.
Okay,
Yeah, yes.
as long as people with diabetes control their blood sugar almost as good as non-diabetics, you have no more risk than normal people. If you do
Doctor,
not
you are-
control your blood sugar equal to normal blood sugars, the
Doctor, unmute yourself, doctor. Doctor, unmute yourself. Unmute yourself.
okay, am I audible
Doctor,
now?
unmute yourself, doctor.
I'm unmuted.
Yeah, yes, doctor. Yes.
Okay. So if your blood
Maran.
sugar values are maintained like a normal person, your immune system will recover and you'll be as good as a normal person. If your diabetes is fluctuating, then your immune system is affected. Okay? So therefore, it's not the diabetes, it is the diabetes control that is important.
Doctor, you
Thank
are-
you very
you
much,
are-
doctor.
Doctor,
Thank
one
you.
question, doctor.
Doctor,
Doctor,
Yes.
Mahesh, wait.
Yes.
Doctor, what is your advice to the school children, doctor? Schools to
That's a
reopen,
very
what are the precautions they have to take?
Very interesting question. As I said, school children are not at any increased risk of severe disease or death. However, school children can get infected easily and they can bring infection home, especially if you are in a joint family system where grandparents and parents are all living together. So therefore, children are vectors and they're not necessarily severely affected. That is why schools were closed very early, because to slow down transmission through children into the families. So there is no longer any particular need to keep children away from schools, but when children go to schools, until the epidemic is over, children as long as they can wear masks in the class, they should, as far as possible, they should sit in alternate seats. And if you are not wearing mask, you should not cough or sneeze without a cover. Like we have been teaching in Rotary for the TB control. Teachers should wear masks and should not be very near the students. They should be keeping about 8 to 10 feet distance from the children. With these minor adjustments, schools can reopen at all ages. Only problem is, if a class has 50 students, you are stuck. You may have to spread the class around into a larger hall or reduce the number of children until after the epidemic is over or a vaccine becomes available. Until then, our lifestyle is going to be very, very different from what we have been used to. We are social animals. The virus is making us unsocial animals.
Doctor, one question has come, Doctor. What is herd immunity in the context of the virus?
Okay, now herd immunity is a concept that infectious disease epidemiologists have been talking about for years, decades. Now, herd is equal to population. Veterinary people use the herd. I have a herd of 100 cattle, or I have a herd of 50 camels, or 200 sheep. That's herd. So you use that for human beings. We have a population of 5,000 in my village, 2 million in my city. That's the herd. Or 1,340 million in the country. That is the population. Herd immunity is people with immunity to that particular virus in the herd. If one person have been infected, the herd immunity is 1%. If 20% have been infected, the herd immunity is 20%. Peak will reach when about half of herd immunity level is, because the bell-shaped curve is mirror image of left and right. So herd immunity is something that naturally happens when infection frequency increases. We want to slow down the herd immunity by slowing down the epidemic. That is another concept called flattening the curve. It's the same. Flattening the curve means slow down the herd immunity. If you don't flatten the curve, herd immunity will occur faster, but then the disease also will be growing rapidly. If the healthcare system cannot cope with it, then we are in trouble. Is that clear?
Doctor, I have one question, Doctor. Doctor, I have one question.
Is herd immunity clear, Maran?
Yes,
Doctor,
Doctor.
I have one question, Doctor.
Mahesh.
Maran, can I
go
have
ahead.
one?
Yeah, go ahead.
Yes.
Doctor, I have two parts of question. One, regarding you advised to wear masks. Now, in social media, we are having something viral, which is said that wearing mask will reduce oxygen level to your circulation in the blood. And the second part of the question is that your herd immunity, which you advise, seems. Whereas the mortality rate of this COVID-19 is universally it is around about 1%. So for 65 crores of Indian population, 1% comes around about 65,000 people. Is it this thing we can have it, or how is that it's possible, Doctor?
Okay, your question has two parts. One is, does wearing mask reduce your air entry, oxygen entry into your lungs? Now, neurosurgeons and cardiac surgeons wear a surgical mask and keep working for 6 hours, 10 hours, 12 hours in the surgical theater. Okay, their oxygen is not going down. If the oxygen goes down, they will not be able to keep their eyes open. So, no,
Okay.
air, even if you sleep with your whole face covered with a sheet, air comes through the pores of the cloth. So, don't worry about oxygen supply wearing mask. And when you wear masks, there are escape in the top of the mask, the bottom of the mask, side of the mask. And that is why mask wearing is not 100% protective unless the infected and the uninfected wear mask. The infected wearing mask, when they cough, can still expel some droplets through these escape routes within the mask. The uninfected person wearing a mask can theoretically inhale some particles that come through these loose places of the mask. But if both parties are wearing masks, infection transmission will be reduced by 95 to 99%. Okay, so mask wearing. The second is our mortality is 1% of what? The entire population. If entire population's mortality is 1%, we will have 13 million deaths. Because 13.4 million is 1% of our population. So it's not some, annually we have a mortality of 9 million per year. So add to that 13 million also. So there'll be 22 million people who will die in 1 year. No, that's not possible. So the mortality rate is not 1%. It's far, far lower than 1%. The mortality rate is 10 to 15% in people over the age of 70, 75. So when the low percentage is distributed between children and adults, children will pull it down, older adults will push it up. So when we have reached the peak, we probably would have had 2 million deaths extra. It could even be 3 million deaths extra. Now, we do not have a system of counting deaths in the health system, health management system. Therefore, we will not know any increase in death unless it is specifically identified as a particular disease. So we do not know how many people are dying in villages, small towns, at homes, small hospitals. We don't have a count. So at the end of the year, if 3 million extra people have died, we will never know. We may have counted 1 lakh deaths or 2 lakhs deaths. The total number of deaths will not be known. In 2020-2021 census, will we pick up 3 million extra deaths? The answer is most likely no, because in the decennial population increase, 150 million will be added. So 150 minus 3 will be 147 million. You will never figure out how many people died during this COVID epidemic. That's because we don't count deaths. Clear, Mahesh?
Hello.
Yes, doctor. Doctor,
Hello.
Mahesh, is it clear?
doctor, can you
Hello.
highlight?
Can you hear me?
Mahesh,
Hello.
Yes, yes, please.
Doctor, it's fine.
Hello.
Maran.
Which type
Yes.
of mask is specific?
Yes.
Is it surgical mask or a mask?
Any mask.
Hello.
Any,
Which type of mask is specific? Should it be N95
Homemade.
or surgical mask will do?
yes, sir, he is answering. Yes, doctor.
Okay, the N95 mask and respirators, very good masks to prevent viruses even in the tiniest of aerosol, should be worn by all healthcare workers working in COVID wards. No compromise. Because the COVID ward atmosphere is full of the virus. So if you or I walk in for 5 minutes and walk out, we are infected in spite of wearing cloth masks. So the antiviral mask should be used by healthcare workers, nurses, doctors, attendants who go inside the ward. No compromise. But in the community, we do not need that kind of mask at all. Ordinary cloth masks are good enough, provided everybody wears a mask. Let me explain. 80% of people infect others without knowing that they are infected themselves. Children particularly. Adults also. Even in adults less than, say, 65, 70, 80% will not know that they are infected, but they will continue to infect other people. That is called community transmission, which has been occurring from mid-March in India, in spite of the fact many top-level leaders want to hide the fact and keep on saying that, no, we don't have community transmission. So the person who does not know is infected, if he wears a mask, when he speaks to somebody, the droplets are blocked by the mask. If he happens to cough, most of the droplets are blocked by the mask. Or if he sneezes, most of the droplets are blocked by the mask. So the probability of transmission goes down by 90%, not 100%. Now, someone else in the vicinity, not infected, is wearing a mask. His probability of getting infected by aerosol in the air will be reduced by 50, 60, 70%. So when you add the 90% of the broadcaster of droplets and 50, 60, 70% of the receiver of the broadcast, your protection is better than 95%, probably 99%. So mask wearing will protect only if 100. Hello?
Doctor?
Hello?
Yes, doctor. Doctor, we are almost at the end of the session, doctor.
Yes.
We are almost in the end of the session.
Mask wearing will, okay, mask wearing, yeah, mask wearing means 100% people wearing mask. Okay?
Yes, doctor.
Maran.
Yes, doctor. Not many as questions.
Maran,
yes, doctor.
Yes, manage the meeting.
Yes, doctor. Doctor, lot many questions are coming still. Can we have one more session, doctor, after a week or so? Doctor, it's a request from the participants. Lot many questions are coming up.
You.
Yes, doctor.
Thank
you so much.
I am under.
Last question,
yes,
doctor.
I'm under
last question now.
I'm always free. Anytime.
Last question, doctor. Last question.
No, the time. It's
what?
Yeah.
Yeah. What if virus got mutation, doctor?
Tell me.
What if the virus got mutation? What happens if virus get mutated for the new drug?
All living live organisms have their genes. Okay, the genes are made up of the its own elements in a string, and the genes are actually like English alphabet or any language alphabet. Don't we misspell sometimes a word, but still the meaning will be understood by everybody, even if you misspell or mispronounce a particular word. Like that, a little mutation will not make any difference to the whole virus. Mutations are like spelling mistakes. Inconsequential by and large. If the mutation is very bad, the virus will not grow. Lethal mutation. If the mutation is very minor, nothing changes. The virulence does not change. Transmissibility does not change. The only worry is, will a vaccine fail to protect against a mutant virus? We will know that only after more research is done. So mutation means virtually nothing today.
Thank you, Doctor.
Doctor?
Zoom has gifted few more times.
Yes.
Okay, Doctor. Last question, Doctor.
Hello? Sir,
Can you highlight on?
Hello.
It's up to you, Maran.
Yes.
Maran, you,
sir,
Maran.
Sendil, Mr.
Sandil, yes, Sandil.
Hello.
Yes, Sandil. Helga.
Sir, ஒரே ஒரு question, sir.
Yes, Sandil.
சார் இப்போ ஸ்கூல்ஸ் எல்லாம் ஓபன் பண்ண போறாங்க. ஸ்கூல்ஸ் ஓபன் பண்ண போறாங்க.
எஸ்.
ஹலோ.
நீ क्वेश्चन கேட்டுருங்க. நீ क्वेश्चन முடிங்க.
சார் கேக்குதுங்களா?
கேக்குதுங்க சந்தில். நீங்க क्वेश्चन கேளுங்க.
சார் ஸ்கூல்ஸ் எல்லாம் ஓபன் பண்ண போறாங்க. நம்ம என்ன மாதிரி வந்து ரூல்ஸ் அண்ட் ரெகுலேஷன்ஸ் இல்ல வந்து ஒரு ஃபாலோ பண்ணலாம் சார். நம்ம ஸ்கூல்ஸ்ல இப்ப ஸ்டூடண்ட்ஸ் எல்லாம் வந்து என்ன மாதிரி நம்ம சேஃப்டி மெஷர்ஸ் வந்து ஃபாலோ பண்ணலாம் சார்.
Wait, doctor. Doctor, he is a reporter of Hindu. He is asking what the measures we can take in the schools. Doctor,
Tell me again, what is it?
We can take in schools in கேக்குறாங்க. Hello, doctor. Doctor?
What can be taken to school?
Yeah, precautions.
What are the precautions to be taken when the schools are opened?
I already answered that. You can open the school with no problem except physical distancing is necessary, but not 6 feet. 2 feet, 3 feet is necessary if everybody wears a reasonably good mask, cloth mask. Is that clear? Everybody by discipline uses hand sanitization after touching any surface. Teachers must know thoroughly the mode of transmission by droplets and by fomites. We call the transmission via touch as fomites. So once you know all this, you can reopen schools without any problem. But what I am telling you as an individual should have been known to you by now. Long time ago, all this should have been known to you by social mobilization by the government.
Meeting loan.
They should have told all these to our citizens a long time ago. It was a major deficiency on the part of our governments that they did not take people seriously and teach them all that they needed to know. Is that clear?
Yes,
Sir, I am Dr. Rasida from Kerala, and I have one doubt. Hello? I am Dr. Rasida from Kerala. I have one doubt. And hello?
Yes, please.
Hello, I am Dr. Rasida from Kerala, and I have one doubt to clear, sir.
Yes.
Can I ask?
Go ahead. Go ahead.
Okay, sir. You have told that, sir, you have told that every health worker should wear N95 mask, when they are going to the wards and all. And what about one general practitioner like me when attending to the clinic? If it is necessary to wear a N95 mask or a simple mask is enough? I want to know that.
That's an important question. From the time we knew that there was community transmission, mid-March,
Okay,
I have been recommending that patients with symptoms, respiratory or non-respiratory, coming to the clinic must wear masks.
Okay,
Doctors
patients should
also
wear
must
masks.
wear masks. Okay, so under
Okay,
those
sir.
circumstances, N95 is not necessary. And if the patient has clinical criteria of COVID,
Doctor, unmute yourself, doctor. Unmute yourself. Unmute yourself. Doctor, unmute yourself, doctor. Doctor, you have to unmute yourself.
Dr. John.
okay. Yes, I'm unmuted.
Yes, doctor.
So can you hear me?
Yes, doctor. Go ahead.
Okay, sir. Here, can I?
Hello. Okay.
Sir, we can hear.
Are you a medical doctor?
Yes, sir.
Are you a medical doctor?
I am.
Okay.
Yes, sir. I am
We are all
a medical doctor.
used to making. Yeah, we are all used to making diagnosis by criteria. Every disease has specific clinical criteria described and taught. So COVID is not influenza-like illness. It's a mistake to call it ILI. Okay, COVID is COVID-like illness. Influenza is influenza-like illness. So the more doctors use the criteria of diagnosis of COVID, the less medical doctors will get infected. The more diagnostic tests can be applied to clinically diagnosed patients. And now we test 1,000 tests and we got 40 positive. If you use the clinical method of diagnosis and then you test, you will probably get 400 positive for 1,000 tests. So it will be very economical to use the PCR test. The way we are doing now is very wasteful of resources of using the PCR test. And who did this? WHO said test, test, test. So we are testing in large numbers. We forgot that medicine is all clinical. We diagnose typhoid fever clinically. We diagnose every disease clinically. And then you apply the diagnostic test to confirm your clinical diagnosis. You follow, doctor?
Yeah.
Is that clear?
Yes, sir. Yes, sir. Clear.
Yes, doctor.
Yes, sir.
We are in the end of the.
Aaron.
Yes, doctor.
We will have another session.
Yes, doctor. Thank you.
You can close.
Yes, doctor. Thank you
close.
so much. Thank you so much, doctor. I thank our former principal and secretary, Dr. Jacob John, and Dr. Daniel, who is here with us today, and all the Rotarians and faculty members of this college, and especially the doctors joined our webinar today. Thank you so much, sir, for agreeing for another session. Thank you, doctor. Thank you, doctor, so much. Thank you, participants. Doctor, I am ending the session now. To all. Yes, doctor.